In today's environment with COVID-19 patients, it's more important than ever to get them up and get them moving. We know with early mobility, patients with ARDS or acute respiratory distress syndrome are able to get off the vent on average 1.5 days earlier, and we can get them out of the ICU on average 2 days sooner. So that's going to be really, really important as our capacity in our ICUs is getting to maximum, to be able to get that throughput and discharge those patients earlier from our ICU and at a higher functional level so that they can go home. What we also know in the current environment is our long-term care facilities and our post-acute care facilities are not accepting COVID-19 positive patients. So if we cannot get them functioning to a high level so they can go home, they're going to have to stay in the hospital for a prolonged period of time, which again is going to take up beds so that other patients are not able to be seen and be treated. So the challenge with mobilizing our patients with COVID-19 is obviously the limited PPE that we have, the number of people that it takes to mobilize some of our patients. And what I'm going to do today is show you how to use a total lift bed to achieve that upright mobility. Because it's their bed, we can do it early, we can do it often, and we can do it throughout the day. Small doses frequently applied of whatever the patient can tolerate. Your heart rate should be no more than 130 beats a minute. Your oxygen saturation should be above 88. Your blood pressure should be systolic between 90 and 180. And your respiratory rate should be between 5 and 40. We're going to lower the side rails and strap the patient in. One of the challenges in the ICU is managing the lines, the tubes, and the drains. The placement is across the knees, across the thigh, and across the chest. Good. Doing okay still? Check that all the vitals are still stable. So the first day, you want to start by tilting up to 20 degrees. You're going to feel the bed coming up. You're watching the vital signs the whole time, and you're also watching the patient to make sure that they are tolerating it. If you're in doubt, you can stop at about 10 degrees, which is right here. You're checking on the inclinometer. It's a good idea to have a second person with you to check the patient as you're monitoring all the lines. We're going to stay here for a couple of minutes. And if you're doing okay, we're going to head on up to 25 degrees. We want to make sure the vitals are still stable. We're watching our patient, making sure that his color is good. You feeling okay, Tim? If they're able to respond, obviously we're getting a thumbs up or a yes in whatever way they can respond to us. Now before I go much further, I'm going to bring the lines forward so that it gives me more slack as we tilt a little bit higher. The first time especially, go up in increments of only 5 degrees, especially if your patient has hypoxemia. Good, make sure that you're not pulling on any lines. Everything's got slack. We're up at 25. Still feeling all right, Tim? I'm going to go up to 30 degrees. And for the first day, we don't go more than 30. Make sure that the knees aren't buckling. Make sure the vital signs are good. Look at your patient, make sure they're doing okay. And day one, you can go up to 15 minutes at 30 degrees. And then we're going to lower the patient back down. You want to try and aim for at least 4 to 5 tilts. And some of our users around the world have told us that that is where they get the best results. For those patients who are awake and are tolerating lower angles well, our goal is to progress those patients each day, adding more minutes or higher angles of tilt to prepare them for out-of-bed mobility as soon as they are able. Patients who are sedated are excluded from traditional early mobility programs but can safely be tilted on the total lift bed because of the security straps. We recommend you have your medical team review and approve all tilting guidelines, especially for patients who are sedated. So on day 1, we stopped at 30 degrees. So we go up to 20 degrees on day 2. Again, make sure that they're doing okay. Check the vital signs, check the lines, make sure the patient's all right. Make sure you're always watching the patient. We're going to go up to 25. Still doing okay? Give me the thumbs up. If everything is stable, after a couple of minutes, we're going to go up to 30. Again, as we go to higher angles, you want to make sure that you bring the machines closer. One of the nice things about using the total lift bed is that you don't have to cross from one side of the bed to the other. All the lines stay on one side. As the patient comes upwards, their chest function and their ease of breathing will get better. It's actually less work to breathe in an upright position than it is when they're lying down. Their diaphragm drops, and that's going to help with alveolar recruitment, especially in the lower lobes, which is very, very important in our ARDS patients. Day 2 and beyond, we're going to go up in 5-degree increments. So we're at 35. The things we want to remember are we want to breathe, we want to get the patient stronger in their upper body if we can, and we want to strengthen their legs, and we want to tolerate upright position. Checking the vital signs, everything still looks good. And now we're at 40 degrees. If the patient is doing well, we can have them start doing a little bit of activity. Good. Okay, I'm going to loosen this just a little bit. If the knees are buckling, we're going to tighten it back up again. But what we want to do is see if the patient can move their own knees. So you can go ahead and bend and straighten. And bend and straighten. Good. Even a little bit of activity like this in their angle that they're able to tolerate is going to help strengthen their legs. Assuming that you have tolerated your 20, 30, 40 degrees, the next step is to go as high as we can all the way up to a full stand. Are you ready? So now we're at 50 degrees. Again, I'm bringing the lines forward with me. So you do want to have 2 people to make sure all the vital signs are normal. Still good? If you can, the goal is to get all the way to 82 degrees. If the patient has any problems, we're just simply going to put them back down again. If their oxygen saturation drops, if he gets uncomfortable, if his knees buckle, and the same thing on the way back down. We're monitoring the signs, we're monitoring the lines, the tubes, the drains, making sure nothing's getting pinched. And then after we've tilted, we'll leave the patient either with the head of the bed elevated, or we can come up into a chair position. It is important to tilt the patient several times a day for best results.